Hi everyone. Now let's give you the extended version of how to do this sterile gloving thing. Pick out your correct size. So how do you know it's the correct size? Well, you should have tested it out last semester and traded for the correct size. If you don't have the right size or your hand size changed over the break for any number of sodium related reasons, go ahead and let your skills faculty know to switch out the right size. You have several sterile procedures during the semester, so sterile gloving is going to be important not only for your first checkoff, but also for Foley, for central line insertion, tracheostomy change. There's quite a few that we do this semester. So your first checkoff is sterile gloving, and you will basically essentially be tested for each of those sterile skills too, because we're watching for sterility. So my size 7.5. Hopefully you saw the struggle in the last video, because it is hard to put on a new pair of sterile gloves with this kind of thickness. So if you are pulling with all of your might, understand that's normal. We still don't break sterile. I'm inspecting the package, opening it. If I see condensation in there, throw it away. If there's mold growing in a corner, throw it away, and that's very weird. Take your empty package, set it away. Have a clear space for you to do this. As you saw, I had to adjust the table to your height, your waist, or above. All right, so now I'm going to show you my hands. I'm opening the package here. We are only allowed to touch the outer 1 inch. That's considered non-sterile. So as I'm opening this is the outside that's going to flip open onto the table, so I can touch the whole outside here. I'm trying to make sure that it doesn't fold back in on itself, because we don't want something that was previously open to be pulled back in. Whole outer 1 inch, I can fold it open. I find it easiest to just pull at the edges here and bend it a tiny bit. Do not touch anything inside this 1 inch border. You can fix and fuss with all of this part, okay? If I want to move it up here, that's all fine and good. Also, don't be opening up other sterile fields on top of each other. You're placing a non-sterile onto a sterile surface, so get another table, have it close by, but don't violate each other. Here we go, outer 1 inch only. I'm going to pick up, you know, your checkoff says dominant hand, non-dominant hand. Okay, that's all fine and whatever. I always put on my right hand first. That is my dominant side. I'm going to pick up the cuff, the edge of the cuff. So my little fingers are inside here. Edge of the cuff. That's the part where your skin is going to be. Okay? I don't want to pull it outside of the sterile area, and I don't want to be draped all over the sterile area. So just pick up the cuff. Now I'm going to slip my hand inside. And yes, it feels like this. Just absolute hell. Ugh. Please go on, please go on. Trying to find my thumb there. The second time you use the glove will be easier. In our skills lab, you only have a few pairs of gloves, so you will be using them a couple times. In hospital, of course, new pair of sterile gloves for each. I don't want to fix or fuss with this glove. If I accidentally got 2 fingers inside 1 finger hole, leave it be. You can fix it after your second pair is on. Do not pull down or touch anything on the sterile part. Grab this and you can tug it down a little bit if you want. That's as far as it gets. Okay? Next thing is I'm going to stick this hand, scoop it, sterile, sterile, sterile. I'm going to touch the sterile part of this glove. Now notice I could just go like this and wiggle my fingers underneath, but you can touch the outer 1 inch. So I would, so that you don't go like this all over the place. Anchor your set here. Pick up, I'm going to show you sideways. Pick it up like that. You can use your thumb to scooch that one on there. But as soon as your hand comes in close, I want your thumb to flag out. You do not want to be even close to touching your sterile thumb to your hand that's not sterile, okay? So you've scooped it on. You may have used your thumb to hold it, and now you're gonna flag out your thumb. This hand is gonna go in. You notice that it stays cuffed. I have great grip. I'm pulling down. Then I slide it out. I don't fuss with the cuff now. Let it be what it's doing, which is semi cuffed on itself. And there we go. I put my hands interlocked above my waist to show that I'm ready. I do not pull it in towards my chest because now it's touching unsterile. This is sterile, this is not. Okay. After the procedure, we're ready to be done. You want to grab here at the waist of your wrist. I guess that's a hand waist. There we go. A wrist. You're going to grab this area and pull it inside out. Ball it in the other hand. Grab the edge, not the top, the under edge. Go like that. Discard. Hand hygiene when you're done.